Hi, I'm Jamie Dean, the Recycling and Green Community Coordinator for the County of Monroe. I work inside the Monroe County Health Department, and I want to give a presentation to you today about how to integrate health into local planning in Monroe County. Although the public health and planning connection has been well documented, public health officials often are absent from the planning process. One issue is that local environmental health officials need to better understand planning principles well enough to participate effectively in the area of land use and community design. Integrating health into local planning is a project designed to identify the best ways local health departments can become more effective participants in local land use planning and community development decisions. As a result of this process, we hope the Monroe County Health Department will become a more visible participant in community planning and a more effective contributor to the local government decision processes. Today, we hope to answer two questions: why health and planning matters, and what you can do to help. This presentation represents the culmination of two intensive focus groups and a number of stakeholder interviews with public health officials and planners in Monroe County. We received feedback from focus group participants on the most pressing issues in public health and planning, as well as ideas for how to better integrate public health issues into the land use planning process. We see local planning commissions as the critical link to ensuring that land use planning and policy decisions help foster a healthy and vibrant community. Included in this presentation are links to a number of Monroe County Health Department resources. Planning originated in the United States as a strategy for improving public health. Zoning was established as a way of separating land uses so cities could develop in a way that promotes a healthy environment. In the face of rapid urbanization, policies were created to reduce congestion, control the spread of infectious disease, improve air quality, and manage solid waste. Today, we see that land use decisions have a huge impact on the overall health of a community. Factors in the built environment, such as access to parks and bike paths, the amount of impervious surfaces, and the number of healthy food establishments have been directly linked to a number of health outcomes. According to the Public Health Association, making healthy foods more affordable, improving sidewalk, street, and land use design to encourage physical activity, and banning public, workplace, and residence smoking are among the most effective public health strategies. Both planning and health officials we spoke with said their primary goal is to protect the residents of Monroe County and to improve health and livelihood of the community. Improvements in the coordination between public health and planning have the potential to greatly benefit Monroe County, especially considering a number of the county health indicators are below the state and national averages. At 31%, the state of Michigan has the fifth highest obesity rate in the nation, and obesity rates in Monroe County are even higher than the state average at 37%. Monroe County is the fourth most inactive county in the state of Michigan. Another concern is access to healthy food. 51% of all restaurants in the county are classified as fast food. In Monroe County, daily fine particulate matter is 24% higher than the state average, and the number of hospitalizations due to asthma is higher as well. Heat is considered the leading cause of weather-related deaths nationwide, and a recent analysis indicated that the Detroit area currently has 5 or more days each summer that are classified as dangerously hot and could have up to 23 days of temperatures over 100 degrees Fahrenheit every summer. It should be noted, however, that Monroe County has taken proactive steps to address these health concerns. The Monroe County Building Healthy Communities Coalition is a committee of health professionals, social service organizations, private sector professionals, and planners that are working to improve the health of Monroe County residents through education and advocacy. One project is the Building Healthy Communities Live Active in Monroe map. You can view a map that highlights local parks and pathways produced by the coalition on the County of Monroe website. Hard copies are also available through the Monroe County Health Department. Your health is determined by 3 major factors, 2 of which are directly related to our built environment and public policies. Family health history. Many people have a family health history of some chronic diseases like cancer, coronary artery disease, and diabetes, and health conditions like high blood pressure. People who have a close family member with a chronic disease may have a higher risk for developing that disease than those without such a family member. Behaviors and lifestyles. Some people are able to eat healthily, get regular physical activity, and maintain a healthy weight. They don't smoke and have a lifestyle that puts them at lower risk for injury or developing a disease. Environment. The environment can directly influence our health, such as whether or not we breathe in polluted air or drink contaminated water. But the physical environment, where we are born, grow, live, work, worship, and age, can also influence our behavior and lifestyle. How your community is designed can affect your physical and mental health. and you can make your community healthier through healthy community design. There are numerous avenues that community design and public policy can impact the health of local residents. A few examples include natural resource policies and land use protections can improve air quality and water quality. Design of the transportation network can impact physical activity levels as well as traffic-related crashes. Sound building codes can ease the devastation of a severe storm. And requirements for on-site stormwater treatment can lessen the flooding impact of extreme precipitation events. People living in more sprawling areas are likely to have higher rates of being overweight or obese and have a greater prevalence of hypertension. Sample policy and planning actions include these listed. Municipalities can adopt complete street policies to ensure active transportation modes are accommodated during road construction projects, or installation of bicycle parking required in site plan review processes. Other planning-related options include securing funding for a Safe Routes to School program, installing sufficient lighting along public paths and walkways, initiating traffic calming measures in residential areas to slow traffic and improve safety, connecting parks and recreation areas with greenways, and supporting recreation-focused economic development strategies such as trail towns and water trails. Ensuring access to healthy food, affordable housing, and transportation options is important from a social equity perspective. In Ingham County, Michigan, a senior housing development plan was modified after a health impact assessment indicated there should be a bus stop with a shelter within senior citizens' walking distance. Making places accessible by multiple modes of transportation ensures all community members can access them. Planners should also work to ensure all residents have access to healthy and affordable food. Examples of policies that could help facilitate this could be expanding zoning for roadside stands, donating public land to expand the local farmers market, and expanding options for value-added local agriculture on agricultural land. Universal design standards should be used to make sure public spaces are accessible to all residents of the community. Universal design is defined as the design of products and environments to be usable by all people to the greatest extent possible, without need for adaptation or specialized design. Placemaking efforts benefit the local economy and often integrate active transportation, public spaces, and universal design. For example, the Heritage Corridor East Master Plan for the River Raisin National Battlefield Park and surrounding area calls for a greenway trail network, numerous public gathering areas, and has the potential to bring a substantial increase in commerce to Monroe County. Another public health-related economic development issue is brownfields. Brownfield redevelopment sites are often vacant for years because of potential contamination. Planners should proceed with caution since these sites have potential for negative health impacts on the community. Meridian Township, Michigan provides an example of a successful early intervention when a Walgreens pharmacy was opening on Grand River Avenue. The health impact assessment checklist was essential in raising early awareness on the possibility of a leaking underground storage tank in the area due to the sighting of a previous gas station business in the location. There are a number of different public health issues that fall under the general topic of environmental health. For example, water pollution. Local drinking water quality concerns include E. coli and other bacteria in groundwater. Monroe County has taken the lead on mapping areas with high levels of sulfur, carcinogenity, and radon. Other concerns are potential contamination from septic tanks, wetland and watershed impacts, and algae blooms in Lake Erie. Another environmental health issue is solid and hazardous waste. Site location issues are important. It's necessary to locate sites away from residents, particularly sensitive populations, and take into consideration disposal methods for generated waste. Finally, air pollution. Focus group participants expressed concern over air quality issues in Monroe County because of proximity to the DTE power plant. Emergency management and emergency preparedness planning deal with a wide range of topics that directly relate to public health. Impacts from extreme heat, flooding, extreme storms, and even infectious disease can be lessened through good land use planning and policies. Attention to planning for extreme weather events is increasingly important given the projection for more frequent and higher intensity rain events and more extreme hot days in southeast Michigan. Extreme heat events. Heat strokes kill more people each year in the United States than any other natural disaster. Communities can work to increase tree canopy by requiring street trees and limiting impervious surfaces. Ensuring that cooling centers are well marked, mapped, and located near sensitive populations is another action the Planning Commission could support. Heavy rain and flooding. A recent public health study found that 51% of waterborne disease outbreaks were preceded by precipitation events above the 90th percentile, and 68% were above the 80th percentile. To lessen potential health impacts, communities can require green infrastructure plans for all new development. Local ordinances can also require low-impact design techniques like rain gardens, native landscaping, or pervious pavement. And finally, severe storms. Communities can require that all public parks and recreation areas be equipped with emergency shelters. A local ordinance could also be adopted that required all public areas to have a backup power source. The literature states that there are 5 strategic points of contact that present opportunities for health professionals to get involved in the planning discussion. These include public visioning and goal setting, plans and planning, implementation tools, site design and development, and public facility siting and capital spending. There are a number of tools and strategies that emerged from our process that we recommend local planning commissions integrate into their plan development and review process. The following we feel will have the biggest net positive impact. 1. Master plan vision and goals. Many cities and counties across the nation have integrated public health-related goals and objectives into their master plan. We recommend that public health officials are invited to the table when master plan goals are being drafted and again before the master plan language is formally adopted. And 2nd, site plan review. We hope planning commissions will use the site plan review reference guide to help ensure that all public health issues are properly addressed prior to development. As noted by the Monroe County Planning Director Rob Peven, planning commissioners already consider public health impacts such as adjacent uses, etc., but broader questions of walkability and access are often not directly addressed. This is a reference guide we created for all planning commissions in Monroe County to use when reviewing a commercial development proposal. Here are some sample considerations you should address. Are there wetlands or other natural features on the site that should be protected? Can the tree canopy be increased to add shade and cooling? Does the site provide access for pedestrians and bicycles, and is there a bicycle rack provided for bicycle parking? Does the site meet Americans with Disabilities Act standards? And is stormwater runoff controlled on site? Are low-impact development practices such as bioswales and bioretention areas used? And this is the back of the reference guide. We included some extra considerations for planning commissioners when reviewing brownfield redevelopment proposals, transportation or corridor plans, and neighborhood level plans. The Monroe County Health Department looks forward to the opportunity to work with your planning commission to connect you with resources that will aid you in making decisions that will preserve the quality of life for Monroe County residents for years to come. Thank you.